select for 2026. And Anju Soni ma'am is the basically person who came up with this weekly webinar 1 hour series where only 1 hour academics without any without actually any fancy things happening here. So Anju Soni ma'am, a warm welcome to you, and we can get this going.
Thank you, sweetie. Thank you. So good evening, Dr. Suchitra, Dr. Uday, and all the delegates and dear friends. We all know that human gut is a vibrant ecosystem and home of trillions of bacteria that play a pivotal role in maintaining our health. And in fact, the number of microbes in our gut are far exceed that found outside the environment, highlighting the significance of this internal community. A healthy gut microbiome is essential for overall well-being, influencing everything from digestion and immunity to mental health and metabolic process. And for women, the gut microbiome is particularly crucial as it directly impacts the reproductive health. Also, the balance of these microorganisms can affect hormonal regulation, pregnancy outcomes, even the onset of menopause. Understanding and nurturing this delicate balance is key to not only achieving optimal health, but also ensuring that women thrive at every stage of life. And today we have this opportunity with the past president Dr. Suchitra of Foxy, Dr. Suchitra Pandit, and past ICOG chair Dr. Uday, who will let us explore the profound impact of gut microbes on health and discuss the strategies to cultivate a thriving microbial community within. Let's delve into the fascinating world of gut health and its far-reaching implications on human well-being. Our chairpersons today are Dr. Uday and Dr. Pratima Mittal. Dr. Uday doesn't require any introduction. He has been Vice President Foxy 2015 and also ICUG Chair. And Dr. Pratima Mittal, Vice President Foxy 2018. And of course, our dedicated coordinators, Dr. Manisha, Dr. Shruti, and Dr. Sini, have also working very hard to work for this program. So over to you, Dr. Uday sir.
Thank you, Anju. Thank you for having me here, and congratulations on setting up this lovely 1 hour crisp webinar on one particular topic with one speaker. It is so refreshing to have this sort of uncluttered program, and I'm very eager to listen to today's talk because this is something which is coming up so very much in practice, and we have so many people coming and telling us, oh, we have this product about the flora, it'll improve the flora in the vagina, it'll improve the flora in the uterus, and it'll help your patient to counteract chronic leukorrhea, or it'll help in implantation of the embryo. And you really don't know, now the IVF clinics are writing it to every patient who's undergoing an IVF embryo transfer. Now, is it really justified? What does it do? How do these orally taken tablets ultimately manifest and work in the vagina or the uterus? I'm very eager to myself get educated on this. And I'm so happy that my old friend, Suchitra Pandit, we go back so long back, and she's going to speak upon this, the past president of Foxy, and she has a lot of laurels to her credit, like the gestosis thing. Does Suchitra have a CV to show, so I can read out a few more things? If Suchitra could share the screen. You are muted, Suchitra.
You're muted. Yeah. Dr. Suchitra, you're muted. You're muted. We can't hear you.
Yeah, okay. Shall I share screen now?
Yes.
Yeah, please. I want your introduction slide to read out few more laurels which you have had.
Yeah.
Yeah, if you can put it full screen.
Is that okay?
She's also the Foxy representative to SAFOG. And she's of course practicing in Bombay at the Surya Hospital, which is a very high tech and a very high risk cases we send over there. So, Chitra, can you make it full screen? It will be good for your slides.
Actually, it is full screen, as
No,
per,
it is not, madam.
I know, but
Yeah.
in
Now,
my thing, it is showing. Okay, now,
Yeah.
okay.
Yes.
so as I was saying, she was also the chairperson of AICC RCOG from 2017 to 2020 and president of ISOPAR and president of the Dystosis India Association, besides being president of FOXY and ICOG in 2014 and 15. So with all that, so many things to her credit, let's listen to the academic side of Suchitra, which is absolutely great. And let's hope everybody enjoys this lecture. Over to you, Suchitra.
Thank you so much. First of all, congratulations, Dr. Anju, for your, vice president elections, and thank you very much for inviting me for this program. And lovely always to have Uday there. We've been meeting so frequently at various academic programs. And I don't see Pratima, but if she's there, she's joining late. Hello to her too. And the topic that I'm going to be speaking on is gut microbiome. And is that okay? So I'm just going to start off with this. And basically, I'm going to be focusing women and gut health. So just before we start doing anything, I just wanted to say that we recently released a Foxy Focus on constipation in women. And this was focused more on the healthy gut. Of course, it does reflect on the other systems of the body, but let's start off with this very important slide. The body's clock naturally follows the cycles of nature. During night time, lunar energy is more predominant, so the body focuses on lubrication, cooling, and nurturing. In the morning, when the sun rises, Agni, that is the sun, the solar energy, the digestive fire is predominant, and the body switches into a heating, active, absorbing, and a transforming phase, and there is elimination of the body waste. If the waste material is deposited into the colon at night, and if it does not get eliminated from the body in the morning, it may get absorbed into the system, and over a period of time, it starts to interfere with the normal body functioning, leading to drowsiness, irritability, fatigue, and this can affect the reproductive health and hamper one's immunity. So, bowel training as an infant is a very essential part of the growing up, and that's where we started off with how important, gut dysbiosis relates to constipation. So let's start off first with this itself. It's a common gastrointestinal disorder and affects around 10 to 15% of the population. Global prevalence is around 14%. Asian prevalence is 2 to 24%, very, very high. And Indians are again between 8 to 24%. And unfortunately, what happens is if it gets into a chronic stage, it can present a substantial burden on the healthcare system. The National Health Portal of India reported that 22% of Indian adults suffer from constipation. So, what about women then? Women experience constipation at a rate 2.2-fold higher than that in men. A community-based survey from India reported that constipation was significantly more frequent in females than in males. And if you're looking at pregnant Asian women, prevalence is 40%, very, very high. Second trimester is 44, third trimester is 36, and postpartum it continues and can become 52%, more so if the woman has had a cesarean section. So let's have a look at this particular study, which is coming from India. Observational study done on pregnant 474 women, postpartum 403, and non-pregnant controls 200. They reported the prevalence of constipation, 49% in pregnancy, 52% in postpartum, and 21% in the controls. So prevalence of constipation reduced after a vaginal delivery as compared to a C-section. C-section probably because of the pain factor. Prevalence of constipation, but 1 month postpartum was low. 9% after a vaginal delivery compared to the control group, and 15% after cesarean section. And the prevalence of constipation was 2 to 3 fold higher in pregnant women and a few days after vaginal delivery as compared to a non-pregnant woman. And during puerperium, but it's not the immediate 4 5 days. It takes at least 4 to 5 days to a week for the bowel function to return to or below that reported in the non-pregnant women. So prevalence of constipation in the reproductive age group. Young women, 21%, adult, that is between 25 and 39, 47%, and middle-aged women between 40 to 49, slightly lesser. But if you're looking at the geriatric age group, it steps up to 40 to 45%. So among individuals 65 years or older in the community, prevalence is 26% for women, and in individuals who are 84 years and older, prevalence is 34% for women. So it does vary by the setting, but even the age group can vary the percentage of constipation. So what are the multiple problems and why does it actually occur? Hormonal and neurological influences, particularly in pregnancy, in the perimenopausal phase, in the menopausal phase, can affect the autonomic system and thereby affect the gastrointestinal motility. And anatomical factors, of course, if there is a poor coordination of the pelvic floor muscles, this can affect the defecation process. And very, very important and a relatively newer concept, imbalance in the gut microbiota, leading to gut dysbiosis. And not only does it slow down the small intestine, causing constipation, it affects the reproductive health, plays a role in PCOS, plays a role in drying of the vagina in the perimenopausal years, can play a role in poor implantation in early pregnancy, and can also play an important role in recurrent pregnancy loss. In fact, ISAR recently had a meeting about this affecting the women's reproductive health. And Dr. Amit Patki, who is the president of ISAR, I think is in the process of getting everything ready, compiled, and will be circulating for everybody to read. And I was surprised to see there have been so many references and so many studies regarding the gut microbiota. So let's have a look at this. Entire female reproduction is impacted by the human microbiome, starting from the follicular development to the fertilization and embryo migration, which I just mentioned, to implantation problems, the entire pregnancy, and parturition. So let's have a look at what exactly goes wrong. What is exactly gut dysbiosis? This is characterized by a disruption to the microbiome, resulting in an imbalance in the microbiota, which changes their functional composition and thereby the metabolic activities. And this probably could also be caused by a shift in the local distribution. And gut dysbiosis has been associated with many diseases of the reproductive tract. As you've seen in the diagram, it starts from here, goes on to the entire genitourinary tract, and thereby the implantation and the pregnancy also gets affected. So there are emerging evidences which link constipation to the gut microbiota dysbiosis. Mainly, if there is a constipation, it alters the intestinal microbiota. These influence not just the intestinal motility, but secretory functions. There is a relative decrease in the obligate bacteria, that is a Lactobacillus bifidobacterium and bacteroid species. And simultaneously, there is a parallel increase of potentially pathogenic microorganisms like Pseudomonas aeruginosa and Campylobacter jejuni. And all these change the amount of available physiologically active substances which are healthy for the metabolic microenvironment, and they start causing the gut dysbiosis, and this eventually spreads to the entire body. So this is a wonderful study. In fact, they have related constipation mainly to the gut dysbiosis, starting right from 2019 to the latest study in 2021. But they've got a smaller amount of constipated individuals with controls, and they have found that Klebsiella pneumonia falls down, but what rises is the Alistypus putridinus, the bacteroids Murday, the Odoribacter splanknicus, the Eubacterium elegans. Again, Yasulina found out Roseburia falls and Caprococcus falls. But the Faecalibacterium also falls with that. Lactobacillus falls, the Bifidobacteria falls. And finally, because of all these falls, the bacteroids, the Prevotella, which is emerging as a very important microbiome, the Lactococcus, the Ruminococcus, the Butyrissimonus, and these Bisulfovibrionoceae start rising, as a result of which they completely upset the gut microbe, the flora, the ecobalance, and that leads to widespread problems. It may not occur in a day, it's over a prolonged period of time. So again, linking it to constipation, when do women most commonly report with constipation, and what are the factors associated with it? Physiological changes which exert pressure on the intestines, which often lead to constipation. In fact, this starts off very early. If the child is not well trained, it goes on into adolescence, ignoring the normal gut reflex and the wrong kind of food. I'm going to discuss that just a little later. And this continues into pregnancy. And as it is with pregnancy, you have elevated progesterone levels, which contribute to delayed gastric emptying time. Mechanical changes related to pregnancy progression. The relaxant is a polypeptide that prevents smooth muscle contraction during pregnancy and also inhibits the smooth muscle activity in the GI tract. Progesterone and somatostatin inhibit the release of motilin, and motilin is basically a peptide hormone that stimulates the gastrointestinal motility. And finally, estrogen and progesterone boost the renin secretion, leading to increased aldosterone levels and greater water absorption in pregnancy, particularly in the second trimester. And in the postpartum period, progesterone-induced decrease in GI time, it starts getting better. Interruption of dietary intake, because women don't tend to look at their diets post-delivery. Lot of dehydration, which has occurred during the labor, continues in the postpartum period. Use of analgesics or opiates during labor. Fortunately, in our country, we don't use opiates, but cultural practices. And there are so many dietary restrictions. There are communities who don't give water, but they'll give soft ka pani or jeere ka pani for 2 months, and the patient actually needs to have a lot of water. Magnesium sulfate treatment, discomfort at the episiotomy site or a C-section related pain. Sometimes there is an anal sphincter injury during childbirth, which causes a pain during defecation reflex and thereby a secondary constipation. Pelvic muscle injuries, which take a little while to heal, and pudendal nerve tears. What about postmenopausal period? Here again, what happens in the reproductive age group can continue into the perimenopause, menopause, it continues. But the biological, physiological, psychological, and social changes, stress perceptions, tension, anxiety, and the cortisol levels can cause constipation in the postmenopausal phase. And if you're looking at the elderly women, in these cases, there may be comorbid factors also associated. Decreased rectal sensation, structural and functional changes in the GI tract, anatomical disruption of the entire pelvic floor, anatomical disruption due to rectocele or rectal prolapse or intussusception, pudendal nerve injuries which lead to an abnormal perineal descent causing prolapse of anal canal and anterior rectal mucosa, vaginal or laparoscopic hysterectomies. Of course, this is there for a shorter period of time, and sometimes there's a vault prolapse following either of these, and that again can lead to constipation. Endocrine and metabolic factors and polypharmacy. These elderly women are so frantic about getting their bowels cleared, they tend to listen to each and every one and different kinds of medication and end up with a constipation. So let us see what are the unique issues related to lifestyles faced by Indian women. Unhealthy eating habits, particularly in the younger age group, increased consumption of empty calories, that is junk food, insufficient intake of dietary fibers. Very surprising to note that many of the kids don't like vegetables. The only vegetable they know is paneer, and they don't like fruits. Sanitation challenges. In the rural areas, there's an absence of or a poor condition of toilets. Open defecation practices still exist in certain parts. Reluctance to use open spaces because they are worried about the patriarchy and worried about safety. In the urban areas, though there are toilets, there is an inadequate toilet infrastructure. Hygiene is not well maintained. There is overcrowding, inadequate maintenance, and many places water scarcity sources. And because of this, many of the women particularly limit fluid intake because they are worried about the sanitation challenges. So then they feel that lesser the water, lesser the reason to go to the toilet, and lesser the reason to urinate or defecate. So constipation hits women much more harder. And that's how it alters the immunity, leads to PCOS, obesity, and the mental health is directly linked to the anus. I'll tell you about this just a little later. And finally, the microbiomes are all happy because they are multiplying inside and causing more and more of a problem. And a small little thing reflects as stress. Therefore, taking care of the quality of life is very, very important. So, what does constipation do? Challenges in engaging in cognitive and communicative tasks, impaired self care aspects, post mobility issues. There are times when women or men difficulty in standing. They're worried about the bad odor, the fecal, the gases which they would pass. Going out, walking for a long distance, a chronic ill feeling, insomnia. And because they're not in control of the situation, impaired self care and anxiety and depression. This doesn't happen overnight, over a period of time. So, what does constipation do in the reproductive phase? It surprising, but abnormality of sex hormone secretions, painful and irregular menstrual periods during pregnancy and postpartum. We've already talked. Pelvic floor dysfunction, hemorrhoids, rectal prolapse, and pelvic organ prolapse, increasing and recurrent rates of preterm premature rupture of membranes or premature labor because a woman is having constipation and she tries to strain at the stools, particularly when there is an incompetent or there is an increase in the intra-abdominal pressure. These are some references which we've got, and that's how we've taken some of those facts. Elevated risk of a spontaneous preterm birth, and impairment of relationship between the mother and the newborn. Many times, these women end up having fissures, and that leads to a lot of pain while sitting. So they're very preoccupied with that, and that can impair the relationship. In the postmenopausal phase, increased cardiovascular risk because there are numerous psychosomatic complaints related to the gastrointestinal tract, such as eating disorders and abdominal bloating. And very, very surprising fact that has come out by this study from San Murago, which is published in American Journal 2011. Constipation is a marker of cardiovascular risk factors. But what is also important is, though the study had 73,000 women, the factors which were associated with constipation were an increased age, smoking, diabetes, dyslipidemia, family history of an MI, hypertension, obesity, lower physical activity, lower fiber intake, and depression. And all these comorbid factors aggravate the constipation. And women with moderate and severe constipation, if they have it, you can actually look at it as, do they have any other comorbid factors, instead of just looking at constipation as an individual thing. So after adjustments of various factors, only severe constipation group had a 23% higher risk of cardiovascular events. So what are the lasting impacts? It can lead to dyspareunia, urinary urgency, hesitancy, a sensation of incomplete bladder emptying, back pain, fecal impaction, very, very common, hemorrhoids, and fissures and involuntary leakage of the liquid stool. So a common GI symptom is chronic constipation, particularly in women with diabetes, hypertension, and hyperthyroidism. In fact, it is not hyper, it is hypo. It's a typo error. So, diabetes, hypertension, and hypothyroidism. And constipation frequently occurs as a symptom in neurological disorders, metabolic, anorectal, intestinal, or non intestinal surgeries. And even many of the medications are antihypertensives, some of the anti-diabetics, the anti-dyslipidemics. These can also have side effects of constipation. And over a period of time, you see these problems, you see that the female predominance of chronic constipation is found in patients with diabetes and hypothyroidism. So this was a study from Bengal, which showed that 61% of patients with chronic constipation had associated comorbidities: 17 diabetes, 10% hypothyroid, 19% organic brain disease, and a combination was 13%. And around 38% of these patients were taking drugs known to cause constipation, like the calcium channel blockers for high BP, the opioids for chronic pain, tricyclic antidepressants for major depression. So there should be a routine practice, therefore, of asking patients with comorbid conditions about the presence of symptoms of chronic constipation and what medications are they taking. So the burden of constipation definitely affects the general health, reduces the quality of life, and there's a significant difference when you're looking at the quality of life in constipated and non-constipated women, and you're finding a negative correlation between women who've got a higher score when you're taking a survey. There's a question card, the SF scores, and if you have got a higher scorecard, you find that there is a correlation between this scorecard and the constipation, and therefore constipation is not to be taken lightly. Now, there are some pragmatic practices for managing the confirmed bowels. As you've already mentioned about the pregnancy, postpartum, and postmenopausal, I'm not going to talk about this slide again, but remember, the physical discomforts due to constipation seriously influence the woman's quality of life during pregnancy and mother's postpartum recovery and galactopoiesis. So, there are gaps in assessment and management of constipation in women. The study of constipation showed, and probably people never thought of it because they thought, oh, this is not an important subject to discuss. But the complexity and the burdensomeness of the instrumental research methods used in coloproctology, many of them are contraindicated during pregnancy, and the causes of constipation in pregnant women are numerous. It is difficult to single out any one reason. There could be multiple. So how do you change the constipation scenario? It has to be started right from infancy to kids, the bowel training. For the school kids, the changes in the diet, inclusion of water, inclusion of fruits and green vegetables and fiber in the diet along with the proteins, regular exercises, because today's kids and many of the youngsters are glued to their computers or the computer games, and they don't have the time or the inclination to go and do physical exercises. So that lifestyle change has to occur. Laxative as and when required. Those who are having a chronic constipation may probably require a more use of laxatives and regular form of exercise. There are beautiful yoga exercises which help in improving the bowel function, and these should be religiously followed. You don't expect miracles in a day, but over a period of time, this definitely helps. And what are the non-pharmacological interventions, particularly effective for resolution of constipation? Counseling of the patient plays an important role in the management. So discuss, talk to them. Some of them don't know the problems of a sedentary lifestyle and a low fiber diet. And after you've ruled out the secondary causes of constipation, counsel the patients on lifestyle changes and timed toilet training, very important for management. Lifestyle changes, I think now today we have, everybody's been talking about it. But one thing I'd like to mention, that many people love to have their, caffeinated beverages and strong black coffee within an hour of rising to promote the gastrocolic reflex and promote defecation. But sometimes, that is a miss or a myth to think. They have to think of having regular fluid water and breakfast, and stop having too much of coffee. In fact, as far as this is concerned, tea is much more better. Tea without sugar, tea, the green tea or the tea which is rich in antioxidants. And encouraging individuals to sit with a straight back on the commode. The Indian toilets were the best, but today everybody's done away and you have the Western toilets. 5 to 10 minutes to avoid the hemorrhoid congestion. Using a footstool to straighten the anorectal angle, very, very essential. Practice deep, relaxing breaths and avoid pushing to improve the outcomes. Actually, this is a toilet training which is done as a child and that has to go in. But if the adults haven't got trained or have missed that training, they can start off with this. And administration of non-pharmacological agents, which includes dietary changes, a lot of fiber like oats, muesli, the citrus fruits, and we have nachni, we have jawari. All these improve the fiber content, improving the physical activities. Even in the age group of people 50 plus, and even in the geriatric age group, people who've got painful defecation and straining to this defecation, some kind of a laxative is necessary apart along with the diet changes. So the recommended dose of fiber intake is 25 to 30 grams. Fibers serve to bulk and soften the stools. Titrate the fiber intake slowly to avoid abdominal cramping and bloating. Minimize the fiber in patients with delayed transit or untreated outlet dysfunction, as high fiber may worsen the constipation symptoms. And biofeedback is important because you want to reduce the outlet obstruction. There can be a dyssynergia which develops in people with chronic constipation. So breathing exercises, maintaining independent mobility, and if this anorectal biofeedback, patients receive visual and auditory feedback to increase intra-abdominal pressure and relax the pelvic floor muscles for effective evacuation. And typically, these are available at some centers, not everywhere. But if it is not available everywhere, there are some other things which can be learned for the biofeedback. But these will not be effective in patients with dementia, Parkinsonisms, learning disabilities, neurological problems, or muscle or nerve disorders, because they will not help. Some other treatment will be required for them. So then what are the complementary and alternative therapies? Staying hydrated, eating more fiber, we've already talked about. Massage, moxibustion, acupuncture, and herbal medicines. These are the traditional practices. But eating more fiber does help. Limiting the high fat, and most important is controlling the food mock consumption, meaning you just see food and you want to eat it, all the right and the wrong kind of food. You have to know which to balance and when to eat what. In pharmacological management, there are certain things which are approved for the dyssynergias and some medications. So let's have a look at that. Most of them will need to use laxatives. There are different kinds of laxative, bulk laxatives, physiological laxatives, osmotic laxatives, or laxatives with a mineral content. So you have to look whether the patient is pregnant and immediate postpartum, you're going to use more of the natural laxatives. And in the non-pregnant stage, you could use something with a little more osmotic effect. But you have to look at the safety. And remember, there can be an laxative addiction. So therefore, along with laxatives, they have to be also taught about regular bowel exercises. And the criteria for an ideal laxative should be good curative effect and tolerability, should not be absorbed into blood. If given in pregnancy, it should not cause developmental defects. If given to lactating women, it should not get into or transfer into breast milk. And so you're looking at efficacy, you're looking at drug dependence, pregnancy, and look at the ideal laxative qualities. And osmotic laxatives are the first line for treating. So the advantage is they help to reduce the occurrence. They prevent the intestinal obstruction, hemorrhoids, and other anorectal diseases. They do not cause serious effects, and they avoid premature birth and improve the quality of life. And lactulose is a very, very common diuretic laxative which is used. At a low dose, it functions as a prebiotic. At a moderate dose, it will help because the effects will vary depending upon the dose. Now, you must know what is prebiotic, probiotic, and symbiotic. Prebiotic is what I just mentioned. It is just helping the function. Probiotic is when you actually add on to it and it changes the effect. And symbiotic is when is a combination of both of them are there. So in a higher dose, it can function in a different way. So the drug of choice is definitely lactulose, high efficacy, prebiotic effect. It restores the enteric microflora. That is very, very important, and it controls the candida infection. Good tolerance sanitizes the maternal passages, and there is no negative maternal and fetal effect. And though it is sweet, it is physiological, so it can even be given to diabetic patients. And there are studies from various parts of the world which have suggested that lactulose, when you're treating them, patients have had a better stool consistency, lesser defecating time, and the dyschezia, that is bleeding during the stools, and the pain during the stools is much more lesser after a lactulose treatment. And even Foxy has recommended using lactulose as being safe and absolutely effective in the chronic constipation which occurs during pregnancy and lactation. And so has the other US FDA, the EMC, as well as the National Health Services. So what is the stepwise management of constipation in elderly women? Because all of these will lead to dysbiosis and lead to the other problems. So it's crucial for addressing multiple risk factors, comorbidities, and medication-induced causes. Prioritize managing medications, inducing lifestyle changes, and use non-pharmacological therapies. And laxative use is important but should be supervised, because patients tend to overdose themselves, and this can cause a problem, cause extremely loose motions, particularly in elderly patients. So what are the long-term outcomes? It improves the abdominal symptoms like bloating, gassy feeling, or the burping that patients get, the borborygmy. It decreases the risk of comorbidities. It significantly reduces the straining efforts at defecation and improves the quality of time. So in summary, constipation is a very, very important problem that occurs in a day-to-day practice. In fact, the US mentioned that nearly 20% of their emergency admissions are because of impacted stools. When these measures are insufficient, so you have to, as I mentioned, lifestyle changes, dietary advice, and pharmacological options like laxatives. Of course, when it doesn't work, you have no choice but to give the soft glycerin suppositories or enemas. And you can't give regular enemas excepting in patients with dementia or neurological problems where they're not able to, the lactulose doesn't work. But otherwise, it works very well in pregnancy, postpartum, in other age groups, and it is effective in improving the stool consistency and frequency, and it has evidence which is suggested to its recommendation in multiple guidelines for managing constipation. Now, one word here I'd like to mention. Where do the probiotics fit? Because lactulose functions as a prebiotic as well as a probiotic. So then do we need to add on separate probiotics? What is recommended today is, for any condition, say somebody has got a bacterial vaginosis or has got a chronic vaginitis, after you've treated with the local therapy and you've given them the oral therapy, follow it up with the probiotics, because they will help, and probiotics at least for a couple of weeks, because they will help to regrow the natural flora, and that will restore their vaginal epithelium. For those who have had chronic vaginitis, probably a month's therapy is recommended. In women with history of preterm labor and PPROM, apart from our regular, you do a high vaginal swab, you give a treatment for bacterial vaginosis, but in these women, giving them oral probiotics is useful, but here you have to give it for at least, what is recommended is at least minimum of 3 months, till the phase, till they've passed that 33-34 weeks, and then you can stop the probiotics. Again, in women who've got PCOS, when we're giving them the dietary changes, the lifestyles, and we're advising them to reduce weight, there are times when you've added the myoinositols or you've given them metformin and you've told them about the diets and exercise, you can add on prebiotics. It's not the first line of treatment, but you can add this on because it eventually helps. But make sure all these patients, you've asked them about constipation. And one of the very important groups is the older age group, where they've got vulvovaginal candidiasis or vulvovaginal problems. So apart from treating the local commensal, improving their gut flora is very, very important. So here and again is the role of probiotics. And of course, for the infertility, we'll have to wait for Dr. Amit Patki to release all his booklets. But from whatever I know, they've talked of using probiotics, particularly in recurrent implantation failures. So when they are stimulating the people, the women, and they have given them all the other medications which are required for ovulation induction, giving them probiotics 1 month prior is recommended till such time that they've implanted, and 3 months after. So nearly 3 months of probiotics. There is also a role of giving the probiotics in people who are having, immune deficiency problems. I mean, they've got a reduced immunity. Of course, you have to find out what the cause of that reduced immunity is. Once you know what the cause is, then the probiotics can be added. We cannot do that as a first line treatment. But today, the NutriBiome Factory is a very, very important subject, where they are discovering more and more of the microbiomes. And we found that one of the important linkages of these gut dysbiosis is to constipation. And that's how we did this Foxy Focus. So coming back to the subject which I spoke about, constipation in women presents unique challenges and considerations, often intertwined with hormonal changes, pregnancy, and various life stages. And us as OBGYNs play a very, very important role. And I'm sure that, I'm sure that the company would be giving the Foxy Focus to all the delegates. And we hope that, because we want people to have this comprehensive understanding and not to ignore this subject, because tomorrow is the world of probiotics. And if you don't change the constipation, the probiotics will not just work. And this is what it contains. And just the last bit, the inside story of our body's most underrated organ. The gut plays a crucial role in our overall health. One must understand the importance of one's gut health. A healthy gut can improve digestion, boost immunity, and even impact the mental health. And the gut-brain connection, the gut communicates with the brain, influencing the moods, emotions, and even decision making. So diversity of the gut bacteria, very, very important, because having a variety of beneficial bacteria in the gut can strengthen the immune system and improve digestion and protect against various diseases. Gut microbiomes can impact mental health and lead to anxiety. And impact of lifestyle on the gut health. Lifestyle changes, diet, exercise, and stress management have found a profound impact on our gut health. And therefore, friends, make sure that you take care of your intestines, because you definitely want the gut to be better, so that whatever we do, whatever probiotics we're using, or whatever we feel like doing, we will be able to have a much more better health. Thank you very much.
Thank you so much, Suchitra, for this lovely lecture. And we learned it at a very, very early stage in our career when we were house surgeons. And we had a registrar who used to come with a very screwed up face and very angry mood in the morning for the rounds. We knew he's constipated. So that's how we know that gut constipation plays a very important part in your mood, at least. And now, of course, we are knowing that it plays an important part in your reproductive system and implantation, PCOS, etc. So that is what is now coming up in a very, very big way. And it is very important that we all are abreast of that situation. So thank you for bringing light to all this and throwing a good focus on it. Lovely lecture. Thank you.
Thank you so much.
So, Madam, I would like to just, because most of the patients who are diabetic,
Yes.
they suffer from this problem very often. So,
Yes.
can you throw some light on this?
Yes,
Because in old age,
like
diabetes is
this
insulin
topic,
resistance also.
yes, you know, the diabetes usually is a if you ask the patients the history, क्या होता है ना, we don't always ask people about constipation, but constipation is a part and parcel of this. I'm not saying always, but there are times when it is there. So these are the women, if their sugars are well controlled, if they're talked to, rather than just changing the insulin doses, or we talk to them more about lifestyle changes, walking, you know, improving their metabolism, those will play a big role. And yes, if they got recurrent vaginal candidiasis, apart from treating the actual fungal problems, please add on a probiotic. And here probably you might want to give it to them for 2 weeks, 3 weeks, and along with them, you know, a regular therapy. In fact, shall I tell you, one of the simplest probiotic without buying it is, you know, chas, buttermilk, diluted buttermilk, not the one with a lot of fat. In fact, it is said that the cow milk se jo chas banta hai, that is very, very good probiotic, and people can actually take it. Then people say, no, but chas पीने से हमको सर्दी होती है, हमको asthma होता है. Yes, I mean, those are the people who are allergic to it, but not, I'm not talking about the bitter one, but the sweet one. So it has to be prepared on a daily basis, but it has to be diluted, and it is an excellent probiotic. Again, you know, eating raw vegetables, or raw salads, particularly onion, beetroot, carrot, celeries, all these are very rich in probiotics. We're talking vitamins and minerals, that is different. I'm talking of probiotics. So even if we can change our diet and include more of these, and today we've got a whole array of oral prebiotics. Loose motions, you know, the first thing that you do is tell them to stop eating, you know, the solid foods, have plenty of fluids, and include, you know, the standard lactobacilli, you know, either oral or sachets, and tell them to drink lots of buttermilk. So, you know, वो simple cheeses, if they change, I'm sure it will make a lot of difference in their management. Hypertension, diabetes, and I feel, you know, older people, honestly, now, Ranju, you're now the president of IMS, older people are neglected. You know, between 50 and 60 फिर भी देखे जाते हैं. 60 plus is 70 की बाद, you know, people tend to assume हाँ ये तो होने वाला है, but we can change that quality of life for them, particularly the diabetics, the hypertensives. And I think today we have to look at preventing this at a younger age. And I'm sure they will agree with me, PCOS is a, you know, growing problem. So हम अगर young age से, all of us, you know, we are all seniors now, but we can train our people not to do just IVF and endoscopy, but also do these lifestyle changing, you know, it will play a big, our country is a diabetic capital, we don't want it to be. We can change a lot of things, and, you know, we can teach the world what it is then, but provided, I think, all of us believe in preventive medicine.
Very true.
Absolutely. You very well said that consuming lots of salads, and even I believe that eating a lot of fruits without roughage,
Yes,
like
yes,
papaya,
yes,
guava, you know,
absolutely,
that can also really help.
absolutely.
Yeah. So in your diet, you should have a good quantity of, you know, fruits with roughage, and not peeling the fruits like apple, and like, you know, even this pears. They should not be peeled, and then it should be consumed with
Yes.
the skin.
Washed,
That is
washed, and have it with the,
properly washed and not
absolutely,
peeled. And
absolutely,
it, you know, a portion should be there, a part of your daily routine.
absolutely. I
Yeah.
mean, whether it's pregnancy, whether it's non-pregnant status, whether it's perimenopausal group, postmenopausal group, and all of them, and everywhere.
Especially older women, as you said, is they are more prone,
Yes,
and they
yes,
need to be, you know, given a focus, because they can't even have that mobility part is also less in them.
absolutely,
Yeah.
absolutely. Very, very true. Very, very true.
So, can we, Dr. Uday, anything from your side?
No, any questions from the audience or any
No,
doubts
there is
from the
no.
audience?
We just checked. There's nothing.
Okay, I think it's wonderful. We can just close it with a very important message what Suchitra has given.
So, Sini, you can take over.
Good evening to all of you, and I'm very sorry that there was some issue in the beginning from
It's okay,
network
it's okay.
connectivity, so I couldn't join on time. So it was a very wonderful session by Dr. Sujitra Pandit ma'am, and so I thank her from my heart to give us valuable insight on the gut microbiota and women's health. And I thank the chairpersons, Dr. Uday Thanewale sir, for being there and for giving his valuable opinions. And it was a very wonderful session because this is not a very frequently discussed topic. And ma'am has very clearly and very vividly explained about the role of gut microbiome, the gut dysbiosis in women's health, and what are the diversity of the gut bacteria, and what is the impact of lifestyle, that we can change our lifestyle so that our gut health will improve, and how this gut health it affects overall a woman's health in terms of hormone balance, reproductive health, pregnancy outcomes, and how it overall affects the quality of life of a woman. And as you very rightly said, ma'am, that constipation, it can even be a marker for cardiovascular risk in women of all the age groups, whether reproductive and more so in the menopausal age group. So it was a very wonderful topic, and you also discussed very clearly about all the different treatment options, starting from the first choice being the non-pharmacological approaches that we have to take regarding lifestyle modifications. And then if it's not effective, then coming to the pharmacological ones and using the best options which are available, like the osmotic laxatives. And also the last slide of yours, which mentioned about the gut by Julia Enders, that was also very wonderful. And it has, I think, all the clear messages that we basically want for today's discussion. So thank you, Suchitra ma'am.
Can I just
And
add, I forgot to mention that, people have got chronic recurrent UTIs. So, we keep treating, keep doing the cultures, keep sending, and the women keep coming back and forth, back and forth. So here the role of probiotics so important because they restore the genitourinary epithelium. So actually in these cases, apart from treating with the antibiotic, you start off with the antibiotic therapy, and as you are finishing, start off with the probiotic and give those probiotics for 2 to 3 weeks. We found wonderful results because the patients then don't come back and forth. And of course, teach them about the genitourinary hygiene. That is important. I forgot to mention about the UTI. So,
thank you, ma'am. And finally, ma'am, and thank you so much, Anju Soni ma'am, for this wonderful webinar series that you have been very successfully conducting. And today we have completed the 30th episode. So that was a great thing. So thanks a lot, Anju Soni ma'am. And I hope in future episodes we'll be continuing to have more such valuable insights regarding various topics which are very crucial, but sometimes we miss talking them in most of the like conferences or things like that, the big events. Thank you so much.
thank you so much. Thanks, Dr. Anju and Dr. Uday for being there. And thanks, Dr. Sini.
Thank you, ma'am.
Thank you, ma'am. Thank you so much, ma'am. So, bye-bye.
Thank you, ma'am.
Should I end this session, ma'am?
Yes.
Thank you, ma'am.